Hello, everybody. This is Mario Martinez, and I want to talk about something that requires, I think, clarity and requires information for people to be well informed, people who seek help and who are well informed consumers. And it'll be about the preferences in healthcare. And usually, you hear people saying, "I love going to my herbalist, and I hate going to the doctor." I love going to my acupuncturist, but I hate to go to my dentist. And has very interesting implications in that why would you love one over the other if they both have to do with healthcare? And I think that the premise in your head is that if you go to an allopathic doctor, is that they're either going to take something out of you, some kind of surgery, or it's going to be an intervention with some medication that's going to cause some side effects or an injection or something that is related to pain. And unfortunately, most of allopathic medicine teaches how to identify pathology. So when you go to the doctor, even though it's preventive, you're thinking, I wonder what's wrong. That's one premise. And I'll try to balance that out because it's going to be very dispassionate. I want to be fair. And the other side, so you go to a herbalist. The worst you can do is you can have a stomach ache or something minor, but you're not going to be any surgery. There's not going to be any medication or any intervention that's going to be so difficult that sometimes is even worse than the cure is worse than the illness. So, although of course, when something is natural or something is organic, it doesn't mean that it's good. Arsenic is natural and organic, and it can kill you. Also, you can take some herbs for depression, and if you don't know what you're doing, it can have an effect when you're eating some particular types of food that can cause a hypertensive crisis. So just because something is organic, it doesn't mean that it's good. So what happens then with the services that are available to you? First, let's look at what it takes to be a physician. To be a physician, you have to have at least 16 years beyond high school, a bachelor's degree for 4 years. You have to go to medical school for 4 years, anywhere from 3 to 6 years in a residency. You have to pass a board. And on the average, when you graduate from medical school, if you have a loan, the average is $200,000. So with a $200,000 loan, you're not going to go to Kenya to do philanthropic work. You're going to have to go into the system, and the system is set up for numbers. It's set up to make money because it's an industry, and you may not get the type of attention that you need, or you may not get the diagnosis that you need in order to be treated like a human being rather than conveyor belt. And that's not a criticism of medicine. That's a criticism of the system of how it works and the power of the pharmaceuticals and the power of systems that are made to make money. And there's nothing wrong with making money. There's nothing wrong with making a lot of money. The problem is that when you're making money, when it supersedes the clinical judgment or the best interest of the patient, then that becomes a problem. So let's go to the other side. You, as a physician graduating from medical school and doing your residency, you're going to owe at least 200,000, sometimes more. Plus, you're going to have to take your boards, and after you take your boards and you go to work, you're going to have a very high liability insurance. Some doctors pay up to $1 million a year in liability insurance. You go to the other side, and you can become a quantum coach for $800 on a weekend. And I'm exaggerating, but some of these things are true. And the accountability is very vague. You're doing something that you say it's healing, and so the less certification that you have, the less accountable you are. It's very important to see that. Now, looking at both, rather than saying either or, it's very important to look at these systems as complementary. If you are looking for services, you want to become very knowledgeable in the alternatives. You don't have to be a medical doctor, you don't have to be an acupuncturist, but you have to be willing to ask intelligent questions when you go see somebody who's going to check your body out, who's going to give you something that could kill you or could save you. So it's very important. Whether you go to the complementaries or whether you go to allopathic, it's very important. That's why I like to use the word complementary better than just alternative. Alternative means that it's either or. And sometimes you need allopathic medicine, sometimes you need more than allopathic medicine. So it has to be more than just a sense of either or. So then when you go to a doctor or when you go to a practitioner, you have to be able to be willing to challenge the information that you're given. I learned that from centenarians. They challenge their doctors and they challenge anybody because it's their body. Your doctor may know more about the physiology of your body, but you know more about the phenomenology of what goes on inside you. So when uh, in medical practice they say evidence-based medicine, it's only evidence-based on one side, on the doctor side, on the medical side. The other side is discarded and is not evidence-based because it's coming from the patient. And I think it's very important that the narrative, the phenomenology, the culture, the history of the patient, beyond the clinical history, is very important to integrate into what's being done. Because people come with culture beliefs, and there are some cultures that will tell you the practitioner, cultural practitioner will tell you this is a terminal illness, and no amount of Western medicine is going to do anything, or the other way around. You go to a doctor and he tells you have 6 months to live, and no matter what anybody does, you have 6 months to live, and that's bad medicine. That's not good science. Science doesn't work that way. Um, but the point here is that whether you go to alternative, complementary, or allopathic, you have to be well informed. You have to be willing to question your practitioners, whoever they are, and also question their credentials and question the knowledge that they have. So, to bring it together, my recommendation for physicians is to become more aware of the phenomenology of the person, of the culture of the person, of the psychology of the person. That it's not only biology, it's bioinformation. On the other side, I think that people that are doing some alternative or complementary work have very little knowledge of biology, biochemistry, and neurology. You don't have to become an expert in the area, but at least you have to know that what you're doing has a biological base and then may have a neurochemical base or psychological base. So it's important to become informed, not an expert, but informed in what you're doing. So you're not just coming out and one day you have an epiphany that you cured your depression because you hugged a tree and all of a sudden you have hugging a tree therapy. And I'm exaggerating, but sometimes it's not far from the truth. So you have to know what you're doing and you have to be willing to be ethical about it. And one of the things about professions, for example, psychology or medicine, other professions, they have ethical systems that say you have to, number one, confidentiality. Number two, you have to maintain a certain amount of disconnection as far as the relationship with your patient or your student. But you also have to know how far you can go with your expertise so that then you can refer to someone. It's very important in a profession to refer. And so you have to know what you don't know so you can refer. Some people think they can fix everything on both sides. And I think that does a disservice to the patients or to the consumers. So I hope this helps in understanding some of the limitations that are now existing between one profession and the other, and finding out what is best for you, and be able to question other people, and don't just rely on authority. Question authority, and then feel comfortable before you give anything that has to do with your body. So I hope this helps, and I hope that you get something out of this. And if you have any questions, you can write me, and I'll try to answer them for you. So enjoy and have a wonderful day.